when would you be a candidate for another ablation? Well, I wouldn't recommend it earlier than that 3-month blinking period, because if you're 1 month out and you're still having some AFib and somebody goes back in there and it's just cells dying off and creating scar, it's a little too soon. Everything's too fresh. You're not really sure what's real, what's not. You're not sure what's going to die off or not. So I would say I would give it the 3 to 4 month period and then see if you have any AFib remaining, and then consider another ablation if necessary. And then lastly, sometimes doctors don't do very complex ablations, even if they're necessary, because they either don't have the skill to, or unfortunately they also make more money to not do that. So if you have 4 walls out of the 6 filled with AFib cells and you're in it 70-80% of the time, and somebody goes in and does a simplistic 1-wall ablation, well, you're likely going to have 3 walls worth of AFib left and still be going in and out of AFib even past the 3-month blanking period. Yes, it could be less, because ablation's not all or nothing. It's more like turning the clock back to an earlier stage. So if they did get rid of some, it could be less, but it's likely going to still be a fair amount remaining if they didn't do very much. But then sometimes that's masked because they may put you or keep you on an antiarrhythmic medication, which are those drugs that keep the AFib asleep. Remember, when we treat atrial fibrillation, we can slow it down with rate controlling medications, medicines that don't suppress the AFib or keep it asleep. They just slow it down and try to make you tolerate it better, or stronger antiarrhythmic drugs that actually work directly on the AFib cells to keep them asleep. They're just masking them. They're not getting rid of the AFib cells, and they're not keeping you from getting older and forming more AFib cells, but they are masking them until your AFib gets strong enough to override those medicines, or an ablation, which actually tries to turn the clock back and get rid of the cells. Those are the 3 main ways we have of treating it.